I was inspired to get into dentistry because every Sunday our families would get together, and my cousin and I, who is also a dentist now, would go out into the woods and carve little pieces of wood and make things and be very creative. And that combined with the fact that I have a very good ability in the sciences and so forth, it was a good fit. You know, I try to be ahead of the curve on whatever it is, and I think I was one of the first ones to have digital x-rays in the area. When we do crown and bridge work, we have a scanner that eliminates the impressions that most people hate, the bad taste and the stuff running down your throat. That's all been eliminated by taking a 3D digital scan. The crowns that we get from that are much more accurately fit to the tooth, which means they're going to last longer. There's much less adjustment when they come back from the laboratory. It's just been a great addition to the office. We go through a whole screening process. We then go in with this carie-free program, which erases the bacterial fingerprint, as we call it, in their mouth. We create an environment by having them do a few rinses and using some toothpaste. It's all in a kit that we have that only allows the good bacteria to regrow. In 2004, I was in a meeting and I was speaking with this Dr. Kurthy, who had been also whitening teeth for a lot longer than I have, and actually developed a system that gets them permanently white and guarantees the whiteness. Most centers, you go in, they go, well, they get whiter, you might get 3 shades or 4 shades, we can't tell you how white you're going to get. With this system, no, there's a bleaching, what we call a bleaching shade guide, which is very white. And every single patient, no matter how dark they start, will get onto that shade guide. We have a bite appliance called a Bite Soft, which has basically revolutionized the industry as far as I'm concerned. Patients continually basically self-destruct their teeth. So this appliance, this Bite Soft that we're using now, gives me the ability to place people's mouths in the correct position and break that grinding cycle. Most people are nervous going to the dentist, if not all people. They show it in different ways. Some of them, you know, get a pit in their stomach. Some of them just get very talkative. So I did a lot of research, and I found this new system that's just starting to come up. It's called Newcom, and it's basically drug-free sedation dentistry. But basically what it does is it calms the patients down, puts them into a sort of what we call an alpha stage or a pre-sleep stage, where they're still very cognitive but very relaxed. We as the doctor and assistants and so forth and hygienists can do much better treatment on them because we're not fighting their anxiety and so forth. We can get it done quicker. And when the patients are all done, they can drive themselves home. They actually feel better. They feel like they just had a great nap. And we've had this system about 6 months in the office and have nothing but rave reviews from the patients on it. It's very unique. There's only one other office in Massachusetts that has this down towards the Cape, and myself. I'm sure it will grow, but so that's something that they will not get anywhere else, at least at this point in time. I'm Dr. Randall Smith, and I'd like to invite you to make a dental health connection with us.